Okay, it's 6:01, March of 29, 2023. So I'd like to call to order the meeting of the Tri-Town Boards of Health. And the first order of business on the agenda is to approve the 12/20/22 minutes. Do we have any comments about that from the board? Well, I'd like to just make a statement about it. There are two misspellings of Dr. Ladici's name in there. It leaves out usually people leave out one of the O's, but I think they left out both of the O's. So under the circumstance, it was symmetrical, but I think we should add back both O's. Don't you, John?
He's muted.
Okay, so with that change, I don't have any particular issues about it. Does anybody else have anything to say about the minutes?
I guess I should say my name is always spelled wrong.
Was your name spelled
I
wrong?
have 2 N's in Diane and it's always with a 1.
Okay.
You got 2 ones in there now.
And my name's spelled wrong because I don't have an E on my name.
All right. We got a parlay going on here, so we'll fix it. We'll go through all that.
Okay, as long as
Okay.
you brought it up.
Okay, can I have a motion to approve the minutes with those suggested spelling changes?
I make a motion to approve the minutes of 12/20/22
A
with
second?
those changes, yeah.
I second that motion.
All right,
Okay,
roll
thank you,
call.
Joanne. May we have a roll call vote?
Diane,
Yes,
Dr. Kenny,
Yes.
Joanne,
Yes.
Dr. Ladice. You raise your hand if you want. You're on mute. Dr. Kearns,
Yes.
Carissa,
Yes.
Dr. Blagg,
Yes.
Dr. Schwerner,
Yes,
Dr. Westpeiser.
Yes,
Perfect, thank you.
Okay, so the next order of business is the citizen speak time. This is when we welcome citizens to give some ideas about what we might be thinking about and how we will do things. So we would appreciate a 2-minute limit so that everybody gets a fair chance to speak and we can revisit things if that needs to be done as we go along. So please understand the 2-minute limit while you're speaking. And secondly, I just want to say that during this meeting, we're at a later point going to have a public hearing. At that point, there will be another opportunity to speak. Citizens will be given 3 minutes at the time, and I think it's important to have more time then, and we'll try to get even more discussion in. It will be specifically related to the proposed tobacco regulations. So I just would say to you that if you want to speak about the tobacco regulations, if you want to speak at both times, go ahead. But there will be a specific opportunity for discussing the proposed tobacco regulations later on in the session, and you'll have even more time at that point. So I'll leave it up. But so can we open the citizen speak time? Jim, would you like to handle that, making sure that everything goes in order in terms of the people who have asked to speak?
We do have some people from the public. If they know how to raise their hand, they can do that. I can call upon you. If you don't, I just put it on video and raise your hand and I'll help sort that out. Does anyone want to speak during regular public comment? We do have a couple people here from the public. Gail, Claire, did you want to speak during citizen speak time? Okay, I'll just go ahead. Go ahead, Gail. I just unmuted you.
Got kicked off, Jim. I think I saw Claire's hand, but she got
Okay.
kicked off.
All right, so I'll unmute Claire. You'll have to unmute yourself, Claire.
I would just like to add that if people could state their names very clearly so we can record it, and also just state your town of residence, that would be ideal.
All right, go ahead, Claire. You should be unmuted.
Hi, I'm Claire Leahy, and I'm just here to see if you're going to be talking about your adjudicatory hearing about the dump and when the next meeting is going to be concerning your review of the health aspects of the UDF plan. So the question is what's the time schedule? Thank you.
Yeah, and so I
Thank
can
you, Claire.
start.
So, Jim, let me just say a general thing for the public. You can ask questions and we're going to record those questions and we'll respond to them at an appropriate time, but we will not, as a board or even individuals of the board, discuss any items that are not on our agenda for tonight at this time. So we welcome any kind of questions. We welcome any kind of statements about anything you want to say about any other kind of a thing. But the board members are not allowed to respond and discuss these things if they're not on the agenda. So we'll record those questions, we'll note them duly, and hopefully at some future time we can consider them if they're not on the agenda tonight. If they're on the agenda tonight, we won't respond to your questions now, but we will when we, during the appropriate time in the meeting, when we can pick up that agenda item. So thank you very much. So Claire, would you like to repeat your question? I thought it was a pretty clear question.
I have the question, Mr. Chair. And between Dr. Westpeiser and I, we can email Claire offline.
Thank you very much.
Yeah.
So now I can retire to my kitchen and fix dinner. Thank
Well,
you.
Claire,
very
I thought the question was going to be about tennis, so I don't know what to
Well,
say.
I am wondering when you're going to come back and play on the Greenwich courts.
Okay,
I
well,
do
if
too.
I can get my shoulders together, I will. So
Oh,
we'll see.
okay.
Okay, thank you very much
Thanks
for your
very
comments.
much. Bye-bye.
Now there's.
Hold on, Mr. Chair, Hank's
Mm.
trying to come back in. So, Gail, did you want to speak during citizen speak time, or are you here just to listen? Let me go ahead and try to unmute yourself, Gail. You should be able to unmute yourself. Go
There,
ahead.
okay. Basically, I have the same question as Claire. It's a scheduling thing. We saw your meeting and basically wanted to know when it would be discussed. And I see that there's more than just the Lee board here. So is it going to be just the Lee board that is involved with that discussion?
The Lee Board of Health, the Tri-Town Boards of Health is a regional board comprised of the 3 towns. What you're asking is very specific to the Lee Board of Health only.
Right, right. So I'm just trying to figure out, what the schedule is, like in a month or 2 or whatever it's going to be, that's all we're trying to find out,
Yeah.
So,
I'm
So
sure
if you
Dr. Westpeiser is the chair of the Lee Board of Health, and I can communicate with you separately.
okay, great. All right. So everything's about tobacco tonight. I take it. That's the executive meeting.
All right, thank you, Gail, for your comments.
Is-
Um,
Okay, but is the executive meeting is about tobacco, not about
Oh, yeah,
anything?
okay, yeah, well, it's not an executive meeting, actually, it's a hearing.
Oh, okay. All right. All right. I might watch for a while. Thank you.
You're welcome.
Let's see, anyone else from the public? I don't see anyone that called in. I'm not sure, Zach, if you see anybody else that's here for citizen speak time, Mr. Chair.
Okay, so if you don't see anybody else, does anybody else want to speak during the citizen speak time? Okay, so we'll move on to the next agenda item, which is a public hearing on the proposed tobacco regulations. And so, Jim, do you want to just introduce this idea a little bit about what's going to be happening during the hearing so that everybody understands how we're going to conduct the hearing? Then I'll open the hearing for the public comments, which I'd like to hold to 3 minutes at a time the first time around until we're sure we have enough people, enough time for everybody to speak. And after that, we'll close the hearing and the boards will deliberate about it. But first of all, I'd like you to, speak up about it. And I think you ought to make sure that you have your disclaimer in about recording the session tonight, if you haven't done that yet.
Yes, so this is March 29th, 2023 Tri-Town Board of Health meeting. This meeting is video and audio recorded and will be put on CTSB TV after the meeting. So for the board, just a quick summary. I'll give a quick overview of the tobacco regulation, which is we've been working on since 2019, pre-pandemic, and so then I'll give a quick summary. Then the chair can open up the public hearing to allow comments, take those comments, close the public hearing, and then the board can either choose or not choose to ratify the regulations with a July 1 effective date. So basically, the summary of these regulations is we have existing regulations that have been on the books. I think we may have updated them in 2016. And with the state law being passed in 2019, in response to the vaping epidemic, a lot of the localized regulations sort of became null and void. They changed a lot of the fine structures. They actually banned flavors in menthols statewide. And so many boards of health have the authority to update their regulations as long as it's not in conflict of law. And so what towns are doing is they're sort of merging the state law regulation into the local regulation. So it's one document. So the majority of the regulation changes compared to what we have in the books now encompasses a majority of the state law, which we don't really have a choice. They changed the fine structure to minimum $1,000. We don't really have a say in that. But the options that this board has decided on, and we notified all the retailers with plain notice. Zach sent letters out, emailed them. Notice went in the paper for the public hearing. So retailers know that this is coming. And so one of the things that's a challenge for us locally is most flavor tobacco products are restricted and can no longer be sold. And so the big tobacco, in response to that, now puts out different products on the shelves that are flavored that aren't part of the state law, like flavored hemps, flavored rolling papers, and all these other products are coming out. And it's an inspection and educational enforcement nightmare. A, B, it acts as a flavor enhancer, and it kind of goes against the spirit of public health and what we're trying to do locally and statewide. So in addition to the already restricted products, you can't sell flavored CBDs, for example, you can't sell anything flavors, can't sell anything menthols. And so we're trying to get rid of all the different types of flavors to alleviate any confusion. It helps the store stay in compliance. Second part is we are asking that stores will no longer sell blunt wraps effective July. One of the things that we have also is we have a permit cap for the number of available tobacco permits for Lee and then Lenox and then Stockbridge. And so what the regulation change will do is if no one captures, so if a store closes, we have an available tobacco permit, for example, kind of like alcohol. If no one captures that permit within a certain period of time, we retire that. And so over time, we reduce down the number of tobacco permit holders over the longevity of our communities. That's something we all decided on quite some time ago. And other than that, it's really a reflection of the state law. And Mr. Chair, if you want, that's my summary. If you want to open up the public hearing for comments, you may do so whenever you're ready.
Okay, so I'd like anybody I don't see anybody myself wanting to speak there, but anybody who'd like to speak up, please feel free to do that. And since there really are not very many people lined up at all that I can see, you can speak as long as you want to. So whoever wants to speak at this point, I'm going to ask you to register or do whatever you feel you want to let us know. Do we have anybody up there, Jim? I don't see anyone.
Well, someone wants to raise their hand. I don't really see anybody.
Crazy people they were inviting as guests.
John, you're not part of the public, so
Okay, I thought maybe you were going to open it up for discussion.
no,
Okay.
we'll just hang on a little bit and I'll let you get in there. I don't see anybody from the public here. Do you, Zach, do you see anybody?
All right, well, it's up to you to close that public comment.
Okay,
for
so
the
we don't
hearing.
have any public comments here. Since there haven't been any public comments, what I'm going to do is I'm going to ask the board to, I'm going to close the public hearing now. And I'm going to ask the board to feel free to ask Jim any questions and deliberate as much as you want to. Go ahead, John, you want to start it off?
Yes. Jim, in regards to these restrictions on the sale of tobacco that's flavored, now this is basically carrying out, this is a question I'm asking. Are we carrying out the state laws and how do we enforce that?
Well, so there's a couple parts to that question, John. So the state law has identified a whole number of tobacco products that are no longer allowed for sale in the Commonwealth. You can't sell any flavored vapes, can't sell menthols, you can't sell this, you can't sell that. But there's these other products kind of coming on the market now that don't necessarily have nicotine or tobacco. It's in response to all these restrictions across the state. They're coming out with flavored hemp wraps, for example. They're increasing the inventory on flavored rolling papers. And so as we're restricting these products over here, Big Tobacco is now increasing new innovative products over there. And so it's becoming an enforcement nightmare and it's attracting to the youth. So we are.
Excuse me, Jim. There's somebody in the background needs to mute their listening to radio or something.
A lot of feedback coming from somebody. Okay, so what we're doing, John, is the regulation merge deals with the state regulations on the flavors, but we're also adding some local product changes as well. And how we enforce that, there's two things we do. Tri-Town administers the 14-town tobacco awareness program, which is a statewide grant that we've been funded for 27 years. So we actually have grant funding where we have Kate, John, and we train our Tri-Town staff just to make sure everything is where it needs to be. But our tobacco program does a lot of educational visits. They do the youth compliance checks. So we have a pretty good handle on that program, and it's something we've been doing for a long time.
But I guess my question was specifically, do we go out there and inspect and then report? What is the enforcement process?
So we do multiple types of inspections throughout the year. We do educational visits, which we go to every single store that sells tobacco. We give them packets, we educate them, and the whole point is to make sure that they understand the rules and regulations. Another type of inspection is where we actually hire youth under 21 and we actually send them into the store to see if they sell tobacco. If they don't sell, great. If they do, we do enforce that. And what we do, John, is we have the authority through the Board of Health, as we're your agents, we do the enforcement there. Then any type of appeals goes right directly to the Board of Health. So we've been doing that process for a long time.
So does that mean we get
Sting.
like Sting? Okay, all right. And then, well, how do we get do we get the constabulary involved at this point? Do we go to the local police department, or what's the next step?
We don't go through the police department, just like anything else we do under the Board of Health. Restaurants, septic, wells. We have Mass General Law dictates what authority we have. We do inspections and we do enforcement all the time. Now, if we get to a point where it gets beyond the Board of Health level, we get our town council involved and we take people to court if we need to. We don't really get the police departments involved anymore.
But Jim, when they go out to do these inspections, they are usually with police officers.
No.
Alcohol, my son did it for 4 years and he went out.
Alcohol's different though, Joanne.
Oh, okay, that's just tobacco.
The general laws, the laws for tobacco are totally different than tobacco. You can't sell to someone under 21, but there's no possession law for tobacco. Whereas alcohol, if you walk down the street with a nip, you can get arrested.
Okay, I thought they were.
Yeah, it's a little bit similar, but they're apples to oranges.
Okay.
But Jim,
Thank you.
I have a question then. Are we banning the non-tobacco flavored products?
We are. That's the plan.
But the state hasn't done that yet?
Not yet. They're working towards it, but you know how state law process works.
Yeah.
Well, the other two, just to add to that, we're seeing a lot of fines being distributed to tobacco stores across Massachusetts and Berkshire County. Because what's happening is you have products over here that you can't sell. Then you got products over here that aren't restricted by state law. Then what ends up happening is the retailer gets too confused and they end up with products that are banned from the state. And then they're getting slapped with fines. in a way, while stores may complain that they can't sell flavored rolling papers, it's actually a benefit to them that it'll actually increase compliance for them. So they won't have to worry about anything in their store that's flavored, whether it's a state law or local thing. And that's what we're actually hearing. Some tobacco stores anecdotally are saying, we just, it's too confusing for us. Just get rid of
Yeah.
all the flavors.
Right.
Joanne?
So is that just, this ban will just be Lee, Lennox and Stockford? So in other places in Berkshire County, if they wanted flavored rolling papers, they could drive to North Adams, or, so it's just us that are banning it?
It's not, so there's other towns that have already done it, but boards of health have their own jurisdictional authority, just like Tri-Town does. So Adams actually got rid of the flavored rolling papers. Dalton recently got rid of the flavored rolling papers. And as part of our tobacco program, we actually go out and help those boards of health through the state grant, work through that process. So across the state, it's picking up a lot of momentum. But the whole point is to get rid of all these flavors and all these flavor enhancers. But, we get rid of one product, another product comes in a few years later, right? It's just one of those things, just like vaping. We started dealing with vaping in 2010 when it first came out. And then look what happened, it ends up being an epidemic.
Any other questions? Bob?
I have a question. I think it was 2019, the federal law came down 21 and over for tobacco. In our local jurisdiction, did you see a lot of pushback on that or compliance issues? The reason why I bring it up is each quantum restriction or tightening up is often met with, some initial concern. I know I get a little concerned, oh boy, this is too restrictive, et cetera, free market, I guess. On the other hand, public health, right? So I go like this a little bit, but then each time over the last 25 years or so, it seems to have never really been any sort of a big storm. So what's our experience been as a board, Tri-Town board, and really at the cutting edge of tobacco regulation enforcement with the 2019 federal bump in the age to 21?
Yeah, the majority of the state, Bob, and most of the Berkshire County towns through our program support actually changed the age to sell to 21 before the state or feds did it. So then what ends up happening is the tipping point happens, and then the state law changed, because Massachusetts is very cutting edge when it comes to tobacco control, because our government structure is very unique compared to most states. Most states are county government and so on and so forth. And so with the tipping point in Massachusetts and other states, the feds finally came around. The feds and the FDA are so far behind, and they're also led by whoever's the president, right? So we actually haven't seen a lot of pushback in local tobacco regulations, probably since we started doing the vape stuff in 2012. And so we started getting rid of some of the flavors early on, 2015, 2016. The biggest pushback or blowback was when municipalities in Massachusetts started pushing the menthol restrictions before the state law did it. That's where everyone came out of the woodwork, the tobacco attorneys, the lobbyists. But what they're doing is they're not really coming at the boards of health anymore. They're not really suing boards of health anymore. But it's how they respond is they just come out with these new generational products that nobody even knows what they are. And what they're doing is they're changing the descriptors, the name, and the marketing of the flavors. And they're, instead of grape now, like grape cigarette or grape vapes, they're calling it like intense blue. So they're skirting around the laws, but it's just one of those things that big tobacco has billions and billions of dollars of lobbying, while we have this little minuscule program trying to combat this at the local level. So the long answer is we haven't seen a lot of pushback in tobacco regulations in a while. In fact, most people don't even go to the hearings anymore.
Okay, any other comments or questions from the boards? Well, I have a question. So I get the general idea that one of the goals that you have in mind in putting forward this kind of a regulation would be to simplify the certification of the premises that was selling and make it easier for them to comply, so they didn't inadvertently break state laws and get into trouble doing things like that. Now, I just want to look at, I don't want to go down every item that you've talked about, but let's just take a look at two items so that I can understand these and the purposes for doing this. Let's take flavored paper. So the state has banned flavored cigarettes to be sold, including menthol and other kinds of flavors and everything like that. So it's very easy for me to understand that if you have flavored paper or menthol instilled paper, and then you roll tobacco in it, you end up with something that's simply the same thing that the state has already outlawed. So it seems to me that that kind of a ban is attempting to fortify and support what the state has already done. Now let me ask you, also mentioned flavored hemp. Now, are you talking about only in the special retail license hemp stores, or not in a store that just sells cigarettes or things like that?
We only have jurisdiction on the tobacco retailer stores selling these products. We're not going.
And are they selling hemp?
Well, they are. They're selling all sorts of products that are flavored.
Now, I wonder why I thought they needed a special kind of a permit to sell the hemp. That's no longer the case?
Well, the Department of Agriculture actually oversees the sale of hemp, and they're probably not enforcing it.
Well, but in effect, do they have the right to sell that hemp already?
They can sell hemp, but we have the jurisdictional authority to regulate and flavor enhancers with respect to using of tobacco.
Right.
We're not going to go to a CBD store and like.
Okay, so I'm just trying to figure out why we're because I think hemp is one of the items you were talking about.
It is.
Why are we interested in banning the flavored hemp?
Because flavored hemp is considered an enhancer to be used for tobacco, which violates the spirit of the state law. Just the flavor.
So
they can sell regular hemp.
Just like they would do. Okay, I understand it. So this is simply an extension of the original idea that I think I understand about the flavored paper being used to roll tobacco, that if you have flavored hemp and you roll it in with paper and you roll tobacco with it, then you're getting that flavored tobacco. And so it's serving to enhance it that way. And so your goal there is to prevent, your goal in banning the flavored hemp is to prevent the flavored tobacco enhancement that we already know is bad for your health and that the state has already banned. Is that correct?
Yes.
Okay, thank you. So are there any other comments or questions about the proposed tobacco regulations as Jim has brought them forward?
And this would go into effect in July, which gives us 3 months to work with our retailers. So this is not something we're going to slap in their face and then just be punitive. We're going to work with our stores.
Okay, now before I ask for a roll call vote, does anybody want to make a statement about these regulations, just to express their opinion about that before we go into a vote, or should we just have a vote? I mean, I could just move into a vote if there's no comment.
I have one more question.
John, go ahead.
My question is, again, for my understanding, are these tobacco shops designated as tobacco shops, or does this affect the local grocery store that sells cigarettes?
So there's a combination of permits. Most stores sell tobacco. The larger grocery stores no longer sell tobacco. Price Chopper doesn't sell tobacco because they can't, because they have a pharmacy in there. Big Y doesn't sell tobacco in Lee because they have a pharmacy in there. They're not allowed to sell tobacco, but we have a lot of mom and pop stores that are regular retail stores that also sell tobacco and some cases alcohol. There's 11 in Lee, 6, I think, in Lenox, and 2 in Stockbridge.
Thank you.
You're welcome.
Anybody else? Okay, so Jim, I'd like you to lead it. I'd like to have a motion then at this point that we vote to decide whether or not to ratify the regulations as Jim has proposed them. Can I have a motion to do that?
I move that we ratify the regulations such as proposed.
I'll second it.
Okay, John Kearns is seconding it. All right, so Jim, do you want to have a roll call vote there, please?
Diane,
Yes.
Dr. Kenny,
Yes.
Joanne,
Yes.
John,
Yes.
John 2,
Yes. I thought I was John 1.
Carissa,
Yes.
Noel,
Noel may be muted.
Yes.
Bob,
Yes.
Hank.
Yes.
Thank you, everyone. It's been 4 years in the making, so we can move on from now.
Okay, so thank you very much. The next item, Jim, do you want to bring us up to date on the department's latest activities as well as particularly the efforts with respect to collaboration?
Yeah, so not a lot of updates. We have our Southern Berkshire Household Hazardous Waste Collection, May 20th, 9 a.m. at the Lee Wastewater Treatment Plant. The flyers on all the town websites. There is a pre-registration. The Southern Berkshire Collaborative car seat program that I brought up multiple times, either at the collaborative level, individual board level, or this group. Jill has disseminated almost 100 car seats.
Oh,
And we just wrote another grant in hopes to get another 100 car seats to work with our population to get families a free car seat. We are wrapping up the COVID bivalent booster incentive program. I think it ended today. The state gave us a bunch of $75 gift cards to incentivize the COVID booster. It was pretty popular and busy for a few weeks, but it's sort of tapered off. We are hearing at some point that the COVID shots will have to be private purchase and not be offered to us for free. But we're working towards, finding the resources to cover that. So during the pandemic and subsequently after, we got all those vaccines for free. And at some point, we're going to have to purchase those. I don't know if you caught that the governor did mention that the state of emergency for COVID is going to end mid-May, which may change a lot of the resources available to municipalities, including tests and so on and so forth. As of Friday, the open meeting law extension with respect to remote meetings expires, but the legislature did pass an extension of remote hybrid meetings. It's sitting on the governor's desk to be ratified. Hoping that happens and we can continue a form of remote and hybrid remote meetings. Let's see what else. The Tri-Town budget's all set. That's going to town meeting. Unless there's other collaborative updates, we did have the capacity meeting with respect to the Southern Berkshire Collaborative, is where it was a year-long process where they inventoried all the Southern Berkshire collaborative towns that we're part of, that we're administering, basically seeing what you're doing, what you're not doing. And basically the worse that these municipalities did on meeting compliance with Board of Health stuff, the more chances of funding coming in. And so we're looking at a possibility of getting a significant bump in the Southern Berkshire Collaborative funding, which we're trying to sort out what that looks like. That could be more staffing. One of my thoughts and ideas is we could really use a community health worker, not only for Tri-Town, but for Southern Berkshire. But I don't have a lot of details on that yet, but the Southern Berkshire Collaborative, Hank represents it, Diane's on it, other folks are on it. It's going really well. And so we're doing a lot of great work. The nursing program has really hit doing full steam ahead, and things can only get better with that. You know, the silver lining to the pandemic is that they finally recognized the need to fund public health the right way versus like leaving towns on their own. And it's really my quick update on number 5, unless there's questions.
Any questions? Okay, so the next is another update on the opioid settlement. Jim, do you want to bring us up to speed on that, please?
Yeah, so if you're following this topic, the multiple states have settled with multiple pharmaceutical companies related to the opioid settlement dollars. Every town in the Commonwealth is getting a certain dollar amount over the next 20 plus years. And so public health, Tri-Town, us are advocating that these resources be redirected to organizations that actually are fighting the opioid epidemic. The Rural Recovery Center is one that we're working with. The town of Lenox process was the Board of Health sent an endorsement letter to the select board. The select board actually agreed to redirect that funding to the Rural Recovery Center. Lee, we're giving a presentation, Bob, in a couple weeks to the select board to advocate that these dollars actually go to the people that have been affected by the opioid epidemic, not to go into a slush fund for other projects. Stockbridge, we did talk about it. It's been tabled. We're gonna put it back in front of the Board of Health in a few weeks with hopes to get some endorsement to the select board. And multiple other South County towns have already approved trying to support the Rural Recovery Center, because those are the boots on the ground. They're actually working with the families that have been suffering through the opioid pandemic, epidemic, however you want to describe it. You know, this is a once in a lifetime funding opportunity that is meant to help the families in need. And I keep stressing the important piece of that like we need to do more prevention rather than just administering Narcan. There's so much more that goes into substance use disorder and opioid epidemic. In the Rural Recovery Center, they're doing coaching, they're doing Narcan training. There's so much more that they're doing, and I can send the board members some of the stuff that the Rural Recovery is doing. And it doesn't, I'm not asking for a vote. It's really just a summary update to let the boards know that we're really advocating, putting our public health hat on to put these resources in the right hands.
Jim, does rural recovery help people countywide or just in the southern Berkshire area?
They're not turning anyone away, but it's really a regional geographic kind of setup where they're kind of covering South County. They only have so many, you know, I don't think they're going to drive up to North County, but if someone from North County goes to they have a brick and mortar building, but they go on the road. And so it's a model to replicate across the county.
Okay.
Hopefully we get more services in Central and North.
Do they have services right now in North County?
Not the Rural Recovery Center.
No.
No.
So I understand the Lee board unanimously sent a letter of endorsement for that project, for those funds to be redirected to the Rural Recovery Center. Would anybody from the Lee board, the Lenox board, like to speak up and explain to the rest of us why you had that unanimous endorsement?
I guess I'll talk. So we had our board meeting. We decided it was important to try to pool money because individually, you're not getting enough to really make a difference, but collectively, with all of the 14 towns in South Berkshire, you can really make an impact. So we believe that and sent a letter of that nature to the selectmen. Then we went in front of the selectmen, along with a couple of people from Rural Recovery and Jim, and just explained again that, you know, we're going to be getting all of this money. It really should go to a greater good. And there was no blowback. It was just accepted that this is what we should do. It went almost too smoothly. But
Thank you, Diane. Thank you. Okay, does anybody else have any comments? Does anybody feel like the Tri-Town board should offer a similar letter of endorsement in the future?
I think that would be a good idea, frankly, if it came from the Tri-Town Board.
Okay, well, it's not on the agenda right now, so we won't go forward with it, but I think that it makes a lot of sense to me to go forward with this. I was the one who challenged the idea in the first place at the Stockbridge meeting when it came up, because I didn't quite understand it, but I do think on learning more about it, that it is an admirable way to put money together and help the people that were adversely affected. Gail, are you asking a question there? I'm not sure. Zach, do you want to check that out for me?
Oh, yeah, she's got her hand up. Yeah.
Or Jim?
She's allowed to unmute if you want to allow her to speak.
Okay, is that okay?
Sure.
I'm just trying to figure out, is Hank Schwerner with Lennox? I'm
No.
not sure.
Stockbridge, Stockbridge.
You're Stockbridge. Okay, so Hank goes here. And I got Charles Kenny, and who else is with Stockbridge?
John Loiodice.
Okay, thank you. I'm just trying to figure out who's talking what town. Sorry, I just don't know what your faces and names.
Gail, and if you go to the Tri-Town site, we have a roster of all our board members.
I
who
know, I'm
represent.
sorry, I shouldn't even be wasting your time on this. Sorry about that. Okay, go ahead.
Thank you for your interest, Gail.
Okay,
Does anybody else have any comments about the opioid settlement updates? Or about any of the agenda items we've already covered, if there's something that we didn't, that we missed? Okay, everybody, thank you very much for coming. I'd like to have a motion to adjourn the meeting because we've, far as I can tell, gone through the entire agenda. Can I have a motion to close the meeting?
Oh,
So moved.
second,
We'll do a roll call. Diane,
Yes.
Charlie,
Yes.
Joanne,
Yes.
John L,
Yes.
John K,
yes.
Carissa,
Yes.
Noel,
Yes.
Hank,
Let me think about this. Yes.
and Bob.
Yes.
All right, meeting is adjourned. I'll stop the recording.
Have a
Thank you.
nice, have a
Everyone.
nice
Thank you.
day, everybody.
Thanks.
Good
Have a
Good
good
night,
day.
everybody.
Thank you, Jim.